Good morning. We are continuing the lesson Physiology and Sports. And the topic we are discussing, that is sports injuries. The causes and prevention of sports injuries we have discussed. So today we will discuss about some of the sports injuries, and first we are starting the first aid. First aid, it is an immediate and temporary care given to a victim of an accident or sudden illness before the service of physician is obtained. This is immediate uh, treatment we give to the injured person. That's why it is known as first aid. First, primary. First, we are giving the treatment to the injured person or during any sudden illness is known as first aid. The first aid therapy is very significant, especially during sports injury, because most of the injuries during the sports are recovered by the first aid therapy. Only few major injury which are sent to the doctor or physician, or most of time the first aid therapy is highly beneficial in case of the injuries, any type of injury during accidental injuries and other type of injuries also. The first aid therapy is quite significant. So this is first aid therapy everywhere in case of sudden illness, in case of any kind of injury. We can give to the injured person before we are going to the physician and we are searching for a physician or doctor. This is very important. That's why it is named as first aid. What are the objectives? The objectives of the first aid therapy, first aid treatment, first is to preserve life. We want to save life of the person. Life is so precious. So that's why to preserve the life. Second is to control pain and suffering. To control pain, because sometimes the pain is severe, non bearable. That's why we are trying to control the pain and suffering, the person suffering with. Third is to prevent the condition from being worse. The condition being worse, we are controlling it. That sometime we have seen that the person at the time of injury, the person becomes more serious because the lack of first aid therapy, because the absence of first aid therapy. First aid therapy gives, prevents the conditions from being worse. Sometime, the example I am giving you, during an accident, a person has lost his life because of excess bleeding, excessive bleeding. And That excessive bleeding is because of the lack of the absence of first aid therapy, because if there is first aid therapy, so maybe the loss of blood can be reduced, or we can prevent the loss of the blood. So the condition sometimes becomes worse in absence of the first aid therapy. So first aid therapy, the third objective is to prevent the condition from being worse. To promote recovery, first aid therapy helps to promote the recovery, to get recover quickly. The persons who get first aid therapy at the time of injury are quickly recover, and they quickly recover than the persons who has not received any first aid therapy. So first aid therapy helps to promote the recovery quickly. To get early medical aid, first aid therapy helps to get early medical aid like doctors, facilities and equipments. Whatever facilities and equipments are needed, so first aid therapy will help to provide them. First aid therapy will help to find the doctors quickly. Specific aids, if any needed. So these are the objectives of the first aid therapy. So that's why the first aid therapy is very important, especially in sports injuries. This is more significant, and this is highly important. Now we will discuss the management of the injuries, especially sports injuries, management of sports injuries. This is helpful for any other kind of injuries also. That's why the management of injuries. So soft tissue injuries. Soft tissue injuries, these are the injuries of skin and muscles. We will tell you after this slide then what are the soft tissue injuries. So first is the price treatment. We can remember by the simple word price. The price, P, stands for protect the one. R stands for rest. There should be no more movement of the particular part of the body, particular organ of the body. P is protect the one. We should protect the one completely. Give rest, R for rest. There should be no movement and give complete rest to the affected part. I, ice. Apply ice to stop the bleeding. C for compression. Compression is also given to stop the bleedings. Cold compression is mostly used in the various first aid therapies. Also, sometime the hot compression also used. Cold compression or compression. Compression to stop the bleeding also. And then E, elevation. Elevation means elevating the affected area above the level of the heart to stop the bleeding. When we elevate the affected area above the level of the heart, so definitely the blood flow decreases towards the affected area, so which helps us to reduce the blood loss. Sometimes there is internal bleeding, sometimes there is external bleeding. So the bleeding, loss of blood, so we have to stop the bleeding whenever there is the injury. So elevation helps us, E for elevation, helps us to prevent the blood loss, in which we elevate the affected area above the level of the heart by putting the person in laying position, by keeping the person in the laying position. We can slightly lift up or elevate the affected area above the level of the heart. That helps to reduce the bleeding to the affected part. So this is the price therapy. These type therapies, when we will discuss about each injury in detail, so that time we must remember these therapies, because these therapies will be used for the sports injuries, different sports injuries, as a first aid therapy. Second is mice treatment. Mice treatment, mice therapy. This is the M stands for mobilization, I for ice, C for compression, E for elevation. So M for mobilization. There should be no mobilization. We should not we should give the rest, complete rest to the affected part. There should be no any kind of movement at the site of the affected part or affected organ. So mobilization, there should be no mobilization. I for ice, apply ice. C for compression, E for elevation, compression, elevation, ice. We have understood in previous slide. Third one is the riser therapy. Riser is used to manage soft tissue injuries to reduce scarring and pain for faster recovery. This is a technique to be used as a first aid technique immediately after an injury occurs. What is there in riser therapy? Riser stands for A for rest, give complete rest to the affected part. I for ice, apply ice to the affected area. C for compression, it may be cold compression or hot compression. E for elevation. A for rehabilitation. What is rehabilitation? That we will discuss afterwards. Rehabilitation and referral, we have said. Rehabilitation therapy is used to recover after the treatment of the injury. This is another very important part. Sometime after the injury we get relaxed, that injury is cured. But recovery is very important. Recovery means regaining the strength, structure, shape, size of the particular organ and affected area again. That should become again normal. These are various exercises, various activities are there in the rehabilitation therapy. And referral, rehabilitation and referral. Referral means sometimes we have to refer the patient quickly, referring to the doctor, physician, surgeon. So we should refer. Give rest, apply ice, apply compression, elevation, elevate the affected area above the level of heart, and refer the patient if the recovery is more serious. or rehabilitation. So R stands for both rehabilitation and referral. This is about riser therapy. Next is management of joint and bone injuries. So there are two type of therapies given: rest therapy and price therapy. Price therapy we have discussed before, protection, that we will discuss further. So 4 number is the rest therapy. Price therapy we have discussed in the first one. Protect the one, P for protection. So rest we are discussing. Rest therapy is there. Rest therapy R for rest, E for elevation, give rest to the affected area, affected part or the person, elevate the affected area above the level of the heart, E for elevation. S for support, we should give support to the affected part. In case of sometime the bone fracture or dislocation, we have to give support to the affected area, otherwise that affected area can cause more pain or more serious injury. So support, we should give support to the person. Like muscles injury also, sometime the person is unable to stand, unable to control the affected area, affected part like hand, leg. So we should give support. Support is also there. And then T tight, sometime we have to tight that affected area in case of dislocation, otherwise due to the body weight, due to the weight of the body organ, that will cause severe pain. So this is T for tight. So rest therapy is also there. R for rest, complete rest to the affected area. E for elevation, elevate the affected area above the level of the heart. S for support, support means needed when there is the fracture and there is the dislocation. In case of sprain and strain also, sometimes support is required. Tight, T for tight, because sometimes tightness to the affected area, tightly we press or hold the affected area, because the bone or the joint should not replace more than whatever it is already replaced during the injury. Sometimes due to the body weight, the bone bend and it it, it go away from its position. So that is tight is also required. Another very important in rest part of rest therapy, that is rehabilitation we have discussing in the previous slides. Recently we have discussed the rehabilitation. So what is rehabilitation? Rehabilitation means the recovery after treatment of any injury. So rehabilitation therapies are always given after the treatment of the injury, which includes regaining the strength, structure, shape, energy, and previous state of the organ or the part injured. So we are regaining the same organ, same structure, same shape, same strength of the injured part by various activities, various exercises. So that's why this is known as rehabilitation therapy, which is always performed after treatment of any injury. So rehabilitation can be done by normal movement, in the form of treatment, because sometimes the treatment is longer. So rehabilitation therapy also continued along with the treatment therapy. Treatment is there, the main treatment therapy. Another one is physiotherapy. Rehabilitation therapy can be taken in the form of physiotherapy, massage therapy, training and practice, in the form of training and practice of any activity, any physical activity. So these are the methods by which the rehabilitation activity therapy can be taken. Activity or exercises. Now we will come to the sports injuries. So there are the injuries we have discussed: soft tissue injuries and hard tissue injuries. The soft tissue injuries are there: skin injuries, which are abrasion, contusion, laceration, incision, and muscle injuries are there: sprain and strain. So total there are 6 soft tissue injuries are there. In case the question is there in 5 marks in board examination, so we can explain. So in 5 marks question, we can explain any 5 soft tissue injuries here from here. So otherwise, these 6 soft tissue injuries are there. We must remember: abrasion, contusion, laceration, and incision. These are 4 skin injuries, and 2 muscle injuries are there, which are sprain and strain. What are soft tissue injuries? Soft tissue injuries, soft tissue refer to tissues that connect, support, and surround other structure and organ of the body. The muscles, tendons, ligaments, nerves, fibrous tissues, blood vessels, etc. They connect the tissues, they give support, and they connect with their surrounding structure, so that these are the soft tissues, and that's why these are considered as a soft tissue injuries, skin injuries, and muscle injuries. Soft tissue injuries involve injuries of skin and muscles in the body. So first skin injury and soft tissue injury: abrasion. An abrasion is a type of open wound that caused by the skin rubbing against a rough surface. It may be called a scrape or grate. An abrasion is caused due to friction by the skin sliding across hard ground. It may be sometimes the skin is slightly scrubbed by the surface of ground or equipment. Abrasion are very common injuries. They can range from mild to severe. Very soon, within few days, normally blister layer is formed over the abrasion naturally. So this is a hard rub over the skin. The skin is scrubbed due to any hard or rough surface. So this happens due to the friction, because friction of the skin is always very low, very less than any other object. So when the friction of any object, the rough object is always higher. So it is the injury caused by any object with rough surface. So that object is scrubbing our skin and rubbed with the skin. So that's why it caused the abrasion, in which the topmost layer of the skin is slightly removed. It is highly painful. Especially burning sensation can be felt during abrasion. There's some pictures we can see of the abrasion here. The external layer of the skin, outermost layer of the skin, is slightly scrubbed. It causes lot of burning sensation. And if there is touch of any object, any clothing, anything, that cause severe pain. So as in previous slide we have discussed, then naturally if there is no treatment is given, after that naturally a layer of blister is formed over this abrasion to protect the wound. So abrasion we have seen. So management of the injury abrasion. Wash the affected area with clean water or antibacterial or antiseptic liquid. Apply the cooling ointment to reduce burning sensation and pain. Cooling ointment are available. There are various type of ointment in market. Cooling ointment, they are also known as soothing ointment. So they give cooling effect to the affected area. Keep wound open and avoid further friction. If anything is touching to the wound, it is painful. So keep avoiding touch to the affected part by any object, especially clothing should be removed from that area. There should be no cover. Press therapy should be given. Press therapy, P for protection, R for rest, I for ice, C for compression, E for elevation. So price therapy should be given. Go to the doctor for further treatment. Sometime due to infection and any other things, the injury or the wound becomes more serious. You can see the pictures again. These are the abrasion is there, which becomes more serious. Another picture also we can see the abrasion. So abrasion is that's the external layer of the skin is scrubbed or rubbed. So we will come to the next injury, skin injury, in the next video. So this is, we have discussed first skin injury, that is abrasion.